Hi, in this video I am going to be talking about the basics of Medicaid in the state of Wisconsin. Medicaid is sometimes referred to by the law's title, which is Title 19. So Medicaid and Title 19 mean the same thing, and it refers to the federal law that establishes the Medicaid health insurance program. And Medicaid eligibility varies by state, and there are two different varieties of Medicaid. There's Medicaid for people who are elderly, blind, or disabled, and then there's Medicaid for people who don't fit into the elderly, blind, or disabled category. That is called the non-EBD category, and the first category, elderly, blind, and disabled, is called EBD. And they establish, EBD and non-EBD establish different financial rules. So for EBD, elderly, blind, and disabled Medicaid, there are several different programs that target people at different income levels. And please see the video below about the MAP program for more information on that. For non-EBD people, the Medicaid program is called Badger Care. There are also a few other smaller programs, such as the Well Woman program that targets specific medical conditions, or the chronic disease program. But most people are concerned with the Badger Care program. So in this video, I'm going to be explaining the Badger Care program. Badger Care is the term Wisconsin uses to describe their non-EBD Medicaid program. And there are two varieties of non-EBD Badger Care. First, there's the Badger Care that is available to children and pregnant women up to 300% of the federal poverty level. So they're looking at the child's household income, including the parents, and the pregnant woman's total household income. So for one individual, so this would be a pregnant woman, a single pregnant woman, the income limit is $3,039 per month. For a family of four, so looking at the children now, that income limit is $6,196 per month. So potentially in a household of four, let's say there's two parents and two kids, and they're just under the $6,169 income limit, $6,196, income limit per month. The two children would be eligible for Badger Care, but the two adults would not. And those two adults would need to go through the health insurance marketplace, healthcare.gov, if they're not eligible for some sort of other insurance, like through an employer or Medicare or TRICARE. So if they don't have access to other insurance, then they would be pushed into the health insurance marketplace or healthcare.gov to buy a private insurance plan. And the children may still be eligible for Badger Care. The rules are a little more complicated than that, so it's going to vary by family, but that's the basics of the overarching rule for families in the Badger Care program and children. And for a pregnant woman, the total household is looked at. So the unborn child is not considered a member of the household, but any other children in the household or a spouse would be considered in the financial unit. A legal spouse would be in the financial unit. Now, for people who are not pregnant and are not a child, so we call them either childless adults or parents, that Badger Care has an income limit of 100% of the federal poverty level. So for one person, that's $990 per month gross income. For two people, like a couple, that income limit is $1,335 per month. And both of these programs are full benefit Medicaid programs, which means that medical conditions that are determined medically necessary by a doctor are covered. It is pending the approval of the Medicaid agency, but overall, Medicaid is very comprehensive coverage. Like private insurance, there are often limits on certain services. For example, chiropractic has a 20-visit maximum, and then there's a 30-day waiting period, and there needs to be a new condition. Physical therapy has a 20-visit per year limit in total for Medicaid for Badger Care. So those are just some examples that there are limitations. It's not complete Cadillac coverage, and there are copays for certain services depending on an individual's income, and those copays are usually small. They're usually between $1 and $6 depending on the service or prescription. And again, that the condition needs to be medically necessary that's being treated, and anything that's related to an abortion service is not covered by Wisconsin Medicaid. There are, of course, always some exceptions to these various rules and appeal process for if you're denied services, but that's just a basic overview of what Medicaid and Badger Care mean for most individuals enrolled in the programs. And Badger Care coverage, whether it's for childless adults or parents under 100% of the federal poverty level, or for pregnant women and children under 300% of the federal poverty level, Medicaid does count as qualifying full benefit health coverage. So it meets the law's definition of qualifying coverage, and anyone enrolled in the Medicaid program wouldn't be subject to the Affordable Care Act penalty for not having insurance. It's fully qualifying coverage. And please see the video below for more information on the elderly, blind, and disabled Medicaid programs that have different income limits. Thanks.